If you've recently started taking a new medication and all of a sudden you notice that you're having swelling in your ankles or your lower legs, it could be from the medication. In this video, I'm going to tell you the most common medications that can lead to edema or lower leg swelling. If you know someone who has edema and is taking any prescription medication, then you might help them out a lot by sharing this video with them. You can share it in an email, a WhatsApp message on Facebook. They may not have a clue that their medication is causing the swelling in their feet, ankles, and legs. Medication-induced edema or leg swelling is very, very common, but many patients and many doctors just have no idea that the prescribed medication is causing the swelling. I'm Dr. Ken Berry, a family physician with 20 years of clinical experience, and that's what this video is about. Now, let me give you this list of medications, and I'm going to give you more details down in the show notes below for you or for whoever you share this video with that needs this information so that they can research this further. So number one on the list is Pramipexole, which is usually prescribed for Parkinson's disease or restless leg syndrome, sometimes for sleep disorders. It can cause edema. Number two is Clonidine, which is normally prescribed to lower blood pressure or to treat several different heart conditions. Again, it can cause edema, which could actually make the heart problem worse. Number three is Trazadone, which is typically prescribed for depression, and sometimes it's used for insomnia as well. It works pretty well for that, but it can cause ankle swelling. Number four is the Mao Inhibitors. And this is a class of medications, and I'm going to put the list of the most commonly prescribed ones in the show notes below. It's usually used for either Parkinson's disease or sometimes for depression. Number five is the NSAIDs, or the non-steroidal anti-inflammatories. And I'm going to put a list down in the show notes below. These are usually prescribed for some acute inflammatory disorder or an acute injury, and sometimes for chronic arthritis, stiffness, and pain. It's what these are used for, but they can cause edema. Next is calcium channel blockers, or CCBs. These are typically prescribed for high blood pressure and sometimes for several different heart disorders. They can cause edema. Next is beta blockers. This is a very common class of prescribed medications. There's a list of those I'll put in the show notes. It's typically used to lower blood pressure and hypertension. It can be used to treat heart issues. Some women and some men take it for migraine headache prevention, but it can absolutely cause edema in the ankles. Next is the corticosteroids, or a steroid that you would take by mouth. There's a list of these down in the show notes. They're typically used either for acute or chronic inflammatory conditions, but many people take a corticosteroid for an autoimmune condition. Some of them absolutely can cause swelling in the feet, ankles, and legs. Next is gabapentin and pregabalin. These are seizure medications to prevent seizures, but they are also prescribed very commonly to treat neuropathic pain or neuropathy, and then also to treat fibromyalgia. Pregabalin is actually FDA approved for that disorder, but they can both cause edema. Next is pioglitazone and rosiglitazone, and these are medications to treat type 2 diabetes. Both have been very closely linked to edema. And then the final one is insulin, injected insulin, and there's multiple different name brands of this. There's short-acting, there's medium-acting, and there's long-acting. Insulin, absolutely, it's a very common cause of edema or swelling in the legs, but most doctors have no idea that edema does this, although it's quite common. And it's typically when you first start taking insulin or when you increase the dose of insulin to a higher dose is when you're going to get the edema. There are a few other medications that can cause edema, but it's much rarer occurrence for these other medications. But these that I've told you about today are by far the most common culprits when it comes to causing lower leg swelling or edema. If you enjoyed this video, please take 1 second and click that subscribe button and the little bell button right beside it so that every time I have a bright idea, you'll be one of the very first to know. This is Dr. Berry. I'll see you next time.